Did you know 1 in every 3 Americans has one or more of these conditions? A high blood pressure, high cholesterol, obesity, or diabetes? All of these conditions are major factors that cause strokes. Strokes are the leading cause of serious long-term disability. Every 40 seconds, someone in the United States has a stroke, and over 140,000 people die every year of a stroke. Due to the stroke's time sensitivity and delay in admissions and diagnosis, only 1 to 5% of stroke patients benefit from new advancements in the field. Rapid diagnosis of a stroke remains a major challenge since stroke patients must be diagnosed and treated within 4.5 hours in order to limit or even eliminate post-stroke brain damage. Out of the 3 main types of stroke, 87% of them are ischemic stroke, which occurs when there is a blood clot obstructing or narrowing a blood vessel in the brain. Once an ischemic stroke occurs, all the nearby brain cells die due to the inadequate amount of blood supply to the brain or physical damage from the stroke. It is imperative to find a way to detect strokes early enough to not only save the lives of patients, but also due to the tremendous stroke-related costs, which came up to nearly $46 billion every year in the United States. However, billions of dollars and millions of lives could be saved if there was a way to detect a stroke before it is too late.
Because of the importance of this issue and how it needs to be solved to save millions of lives, there are some existing devices that are currently being researched and improved upon. One includes the Cerebrotech Medical Systems VIPS device, which is placed on the head to detect stroke through low energy waves. However, although this idea is one of the most promising in current research, this idea only detects a stroke as it is happening and is used to prevent further brain damage from a severe stroke, depending on the already occurring symptoms that are measured inside of a patient's brain. Therefore, this device does not help with preventing stroke and instead focuses on preventing further brain damage as the stroke is already happening. Other devices include CT scans and MRIs, and these are commonly used by hospitals to detect stroke. However, these devices not only provide early detection, but they are also not portable and instead are very heavy and require training to be used, instead of being convenient and easy to use by anybody. Therefore, there still remains a need for a new innovative idea that can solve these already existing issues.
And that's where our idea comes in.
Our innovative product is SignStroke, a wearable medical wristband with the capability to recognize a stroke, alert the wearer, and deliver an injection of a blood thinner to hinder the effects of the stroke. In order to detect a stroke, our device monitors the concentration of matrix metalloproteinase 9, or MMP9, a possible biomarker for ischemic strokes. A study investigating early biomarkers of stroke published in the Oxford Academic discovered 5 different biomarkers: S100B, B-type neurotrophic growth factor, von Willebrand factor, MMP9, and monocyte chemotactic protein 1, all of which displayed a sensitivity of 92% when there is a 93% confirmed chance of an ischemic stroke. Within this panel of biomarkers, MMP9 was the most promising because not only does it significantly increase in concentration when there's a potential blockage or disruption in the blood vessels in the brain, but it can also indicate the extent of the damage done by the ischemic stroke, which is very important in understanding which treatments the patient will react best with. To detect MMP9, SignStroke uses a biosensor based on fluorescence resonance energy transfer, or FRET, a sensory system that works especially well in vivo. Once enough MMP9 is detected in the bloodstream, indicating a possible stroke, the wristband alerts the wearer with a notification on the linked SignStroke app on the patient's phone. At this point, the patient will have the option to enter the deliver phase by injecting a medicine from the wristband into their bloodstream as a preventative measure to stroke before admitting themselves to the nearest hospital. These injections can include aspirin or an IV dose of tissue plasminogen activator, or TPA, a more common stroke treatment.
Overall, SignStroke is easy to use, portable, and prevents stroke by detecting it early. Thank you.